For coming this afternoon. We just had a good discussion on the COVID-19 virus and its impact on the state of South Dakota. We talked about healthcare protocols, testing processes, and how our systems are taking care of our families and the folks across the state. We also did talk about schools and economic impact that we're feeling and what to do in the future and make wise decisions with everybody cooperating and working together. In my office and in my state department, what we've been doing is working on making sure that we're being proactive with the Department of Health. I have the Secretary of Health, Kim Malzum-Reisden, with me today. She'll be here to answer any questions that you may have. We also had a cabinet meeting this morning with all my cabinet. We've had an emergency operations center that has been open since February 10th. Tomorrow morning at 8 a.m. we're going to be deploying even more people to that unified facility to make sure that all agencies have talented individuals in there cooperating to address different needs that we may have within the economic front, the labor front, to help families adjust and go through this time, and also on the healthcare front with social services and human services, which deals with nursing homes as well. I had a telephone town hall last night with our legislators. We discussed some updates on the virus, also talked a little bit about legislative session and budget needs and plans for Veto Day. I gave them a heads up that there's no planned bills right now, but there potentially could be something that we may need to deal with on Veto Day that would help the state be set up to be successful to take care of families and businesses going forward in the next fiscal year. We recognize that this virus is having a ripple effect across the state, and we're going to be prepared and make sure that we've got our resources in the right places to deal with whatever might be coming our direction. We also, I'm announcing today that school will stay out next week as well. We will not be holding school next week in the state of South Dakota because we're going to give ourselves a little bit more time to continue to develop out our testing and our lab capabilities to work with our healthcare providers to make sure that regardless of how we go as far as development of this virus across the state, that we're prepared for it and we're ready to take care of individuals who may want to be tested or taken care of if they do test positive. We did have one new case that was tested positive in the last 24 hours. It is a female in the age group of 50 to 59 in Minnehaha County. That brings our total to 11. We have all of the individuals that have tested positive in South Dakota are at home resting and healing up, and that's all really good news for our state. We're in a good spot today, but we're continuing to be proactive and diligent, and I just want to thank these folks that are standing up here with me today for all of their help. Their wisdom, their advice, their medical expertise is helping the state make very good decisions for all of our communities and our families so that we're prepared into the future in the coming weeks for whatever direction the spread may go. At this time in South Dakota, we do not have community spread. That is very good news. It's a different story than what other states around us are dealing with, and I think it's largely because of the proactive nature that we've worked with healthcare providers, with schools, with leaders and businesses and communities throughout the state. So I just want to thank everyone for doing what we do best here in this state, and that's link arms and tackle challenges and make sure that we're getting everybody through it and that we'll continue to be successful. So I will turn it over to Kim to give a couple of general statements, and then we'll see if some of the physicians and presidents and CEOs of the providers would like to make a few statements as well.
Thank you, Governor Noem. I'm Kim Malzum-Reisden. I'm the Secretary of the Department of Health. I just want to reiterate what people can be doing right now to help themselves, help their family members, and help other people that they come into contact with. It's the same message that you've been hearing. It's wash your hands with soap and water, 20 seconds. Use hand sanitizers if you don't have access to water and soap. Stay away from people as much as you can. Use social distancing measures in settings that you come into contact with other individuals. If you come into contact with elderly people or folks that have compromised immune systems for some medical reason, be extra vigilant. Try to help support those people that are in your families, that are in your communities, but be very smart about that. Limit your physical contact as much as you can. We're really asking people to look out for each other. We know people that are staying at home can get lonely. That's a tough place to be sometimes for long periods of time. So I'm really pleased with how folks in South Dakota are responding across the state to take care of each other.
That's great. Did you want to say anything? Sure.
Hi, I'm Alison Sudol, the Chief Medical Officer at Sanford Health, and I'd just like to say how proud I am of everyone working at Sanford and all the work that they're doing to continue to have us be totally prepared to take care of you, not just for COVID, which is coming, but for everything that you need. We are sitting well in terms of our supplies and our preparedness, and every day we're making decisions and anticipating what the needs will be and how this will roll out over the coming days. But that hasn't stopped our day-to-day operations. We are still functioning in all the other areas that we need to deliver babies, take care of heart attacks, and all the other needs and things that come along. It's a difficult time, and I think there's a lot of anxiety for everybody. And I just really appreciate all the employees at Sanford that come out every day and come to work and put aside those concerns of the day to come and be there to take care of our patients and everyone that's needed. I'm proud to work at Sanford. I'm proud of all the work that they've been doing. Looking forward to getting our lab test up and running that we'll be able to do internally around this virus. I think that's going to expand our capacity as a state to be able to test more individuals, to isolate individuals, and to be able to, again, kind of bend that curve and mitigate, if we can, the virus and its impact on our communities.
Good afternoon. I'm Dave Erickson. I'm the Chief Medical Officer with Veto Health. Governor had asked us to comment a little bit about getting lab results back to patients. So we have changed that process where the results come into our centralized lab service, and then from there it goes to our call center so we can get those results back as quickly as we can to our patients because they're worried about that and they want to hear about it. We also are in the process of standing up our lab, and we hope in the very near future we'll have some of that testing in-house. So I think that'll help us. I just want to congratulate and thank the governor for her leadership. I think it's very important, we continue to stay home, work from home if you're able, avoid groups, avoid travel, and certainly the social distancing is very important. So we want you to be calm, but be prepared. Those of us here in the Midwest, we're from hardy stock, and we prepare for blizzards and things like that. We're used to school closings and work and things like that. So these are things we do. This is part of our life, and so we're prepared for it. And I think just continue to be prepared is the message. Be prepared, continue to do everything the governor and the secretary and Mr. Krabenoff and Mr. Sutton have shared, and Dr. Sudol, and we'll continue to work through this. So thank you.
That's great. Thanks.
Sure. Do it together.
You bet.
So I think, if anything, we know we don't want to.
No, you're fine.
Don't want to block her, of course, but you come to a conclusion after some of this that we're always better off in moments like this if we can stand together, if we can talk about the issues, grapple with them, exchange questions, exchange answers, that sometimes we come from different perspectives, and it's a healthy relationship. And I think we both want to assure people that we have a coordinated effort on finding access to resources, to supplies, and also things like the tests that everybody wants access to. We're going to do that together. We hope by the end of the week to have hundreds and hundreds of tests every day available to people. That requires a large amount of chemicals and reagents and other things that make that all work. But it's coming together quite quickly. That speaks to the preparedness of this. I only have the feelings like everybody else does who's not a physician, and that is there's an isolation that we're all feeling now. At home, at work, even in our communities. And that's a difficult thing. I think Dr. Erickson's right. It's a hardy breed here, and we do come together. It's the opposite feeling that we normally have when we're faced with a challenge, because we all come together, and in this one we're being told, don't come together. And that's tough. But I think we're going to get through it without ever losing sight of the fact that this virus has a life of its own, and it's going to take its toll. It's not going to be avoidable. It's going to be managed as best as we, as professionals, working with the best advice we can get to do just that, to manage it. But it's going to have a life of its own, and it's going to find our way into our communities and into our society, and it's going to take the toll that it takes. And thankfully, what we know is for vast, vast majority of people, in the 80s and 90% of the cases, it's very, very minor. and something that you've experienced all your life. But it is something that's very serious. We're doing our best, and we're standing together to do that. Bob?
I think it's important to remember that the actions that we've taken so far have really been helpful to the results that we're seeing today. And that's led by the governor, the healthcare industry coming together in this state to work together on the solutions and what we can do to keep this, to keep the impact where we have it today and to hope to flatten that curve as we continue to talk about. I would also make the point that we are made for this. This is a calling that we all have. Everyone in every one of our facilities is called to respond and to be here in these times. We're still taking care of patients at every single age group and at every level for lots of things that don't have to do with COVID. And if you have health needs, we need to continue to reiterate to people that we're here to serve you. We will address COVID patients, we will address this situation, but we're still here. We're called every single day to take care of the people in the communities that we serve, all the health systems, not just Avera, not just Sanford, but all providers across this state, and we stand ready to do that. We're going to address this issue in accordance with the governor, the Department of Health, the CDC, and the things that we're doing, but we're paying attention to all of our patients and all of our communities that we serve, as we do each and every day. And I would just reiterate what Kelby said. We're going to continue to have these conversations, and we're going to continue to make progress, and we will manage this as it goes forward. We're just doing everything we can to keep those numbers manageable in the near future.
That's great.
Bring us to a close.
Yeah, so I just want to reiterate that we are following all the protocols that are recommended by the CDC and testing. People who come in and are not feeling well, we ask that you don't go to the clinic, you don't go to the hospital, that you call your doctor, you call your provider, and they will tell you how to go through the protocols to see if you need to be tested. Continue to do that. That is still the best process for making sure that you receive testing in the state, and that also we're checking all the boxes to make sure we're protecting other individuals and our healthcare providers who we need to stay healthy in order to continue to take care of the population in this state. I would like you to continue to use our website as a resource. It's covid.sd.gov, COVID.sd.gov. We've had over 330,000 hits on that website, which means people are using it. That is fantastic. There's an 800 number that you also can call. This is not the number you call when you're sick. You call this if you have questions, if you don't know what to do. That number is 1-800-997-2880. 1-800-997-2880. Call that if you have questions. If you are sick, call your provider, call your doctor, and they will help you make sure that you're getting tested. So again, with the school announcement, beyond this week, we will be delayed one more week, and that is to allow us time to make sure that we have adequate laboratory testing and supplies for whatever may come our direction. And I'm confident in the folks here in South Dakota that we are well prepared to take care of the families that are here and make sure that we're making wise decisions going forward. So let's open it up to any questions that you may have. Jonathan.
Governor, the Secretary has some pretty broad powers to mass closures if she needs to with consent, I believe. Can you discuss like what a tipping point or trigger that would be?
Well, what is encouraging in South Dakota is we don't have community spread at this time. Community spread is typically defined by the CDC as people that are infected that you don't know how they got infected with the virus. All of the incidents of positive cases in the state of South Dakota are tied to travel beyond the state's borders or in very close contact to individual that has traveled. So we do not have community spread at this time, and that is very good news for us. So we do have authority, we do have powers, we're given some opportunities from the federal government as well to have waivers, and we're preparing for all of that, although we're thankful we're not in that situation today that so many of our surrounding states are.
How close are we to widespread, readily accessible COVID-19 testing for anyone who wishes to have access to it?
Well, I still wouldn't advise that. We don't even necessarily do other lab testing under that mechanism. There is no laboratory testing that's available to the general population by demand. It's always in conjunction with what your physician recommends. And so we are handling this virus exactly like we would handle any other virus, any other condition that would require laboratory testing. So I think that should give folks the reassurance that their decision making is still happening with them and their doctor, and that they will will go through those protocols, check their symptoms, see if they need to be tested for something else like strep throat or influenza, and then decide if they need to be tested for COVID-19. So anyone who has checked all those boxes, met those protocols in South Dakota, and their doctor thought they needed to be tested, has been tested in our state. So the testing supplies have not been an issue for us, and we're thankful that people are making good decisions about their health.
Have you considered yet about the Sudol City Council election coming up in a couple weeks?
You know, we've been working with obviously our Secretary of State's office, and then also with experts within state government and local offices on what we need to do as far as elections that are coming. You know, I think that with the Sioux Falls City Council, we're having those ongoing discussions, so no decisions have been made. But I know we have several other communities that have been asking us for some leeway if we would change petition processes, if the dates would be changed. We're evaluating that, and if there is some needs that have to happen for changes in statute, that we could potentially deal with that on Veto Day, which is when the legislature would come back. But we're not at a point where we can announce any decisions.
Governor, this latest case had traveled or was connected?
It was connected to travel.
Through somebody else, or they had traveled?
I'll let Kim talk about specifics because of HIPAA requirements and other, but I'll let her share with you what we're free to share.
Thank you, Governor. So again, the case that was announced today had travel themselves, and so that is what the case is connected to.
Governor,
Yes.
call with legislators last night. Was there any discussion about resources available in the state budget, the possibility of bringing that up on Veto Day or special session?
I let them know that Veto Day, we may have a couple of other topics that come up, and that if we were going to open up and suspend the rules to bring other bills forward on Veto Day, that it would be limited to the COVID-19 response and adjustments we may need to make from that going forward. So we have literally every single agency and department right now working overtime to make sure that we have the resources where they should be, and they're prioritized towards taking care of the people of South Dakota, and then also how we can partner with other industries and families across the state. So we will know more as we see how the next week or so goes, and then also what we may need to do on Veto Day just to make sure we have the flexibility to put resources where they need to be for response.
I wanted to ask about testing. This seems to be a problem at the federal level, and it sounds like it's trickled down to the state level. Why wouldn't you want more testing? This is probably for the medical providers. Why wouldn't you want more testing? Some experts say for every one we catch, there might be 5 more cases that are undetectable. So what's going on with that? And on the other hand, South Korea's testing 10,000 people a day.
Right. I think we want to test more, not less, so we can have a surveillance on the disease and where we're at. So we would agree with you. We want to do testing. Sanford's in the process of standing their lab up. Avera's in the process of standing our lab up, and we hope in the very near future, in the next few days, we'll be able to go live with that and give the state additional capacity within Sanford and within Avera. I'll let Dr. Sudol answer also.
Yeah, no, I agree. I think the capacity that we've built up with the different systems in the state will allow us to have adequate testing for the population of the state of South Dakota. I think we're ramping up to an adequate level of testing.
So what do you need? What is it you're missing? Is it test kits? Is it the chemicals to process the test kits? Is it technicians to do the tests? Where's the logjam?
I would say that everything that we have done in South Dakota has been under the recommendation of the CDC on who should be tested, what those protocols should be, and we've followed those in conjunction with our providers and doctors' insight. So we've handled the testing much like any other lab testing would happen. And before you order a test, you make sure that you're checking off other possibilities that disease or symptoms could be stemming from. There probably will be more testing that will happen as we gear up to process those. You can do a lot of testing, but if you can't process the tests, that certainly doesn't do us any good. And it has been helpful for us to test in order to know if we do have community spread, you know, how people maybe become infected. And so that has been helpful. I don't know if we'll ever get to a place where every single person who wants to be tested will be tested. That just hasn't happened in the medical arena before, and I'm not sure that this virus would lead us to a point where that would be necessary either.
The president said he'd like to see drive-through testing. In fact, some countries like Korea, Japan have gone to that. Do you see a day anytime soon where I could go to Walmart or I could go to one of your clinics and go through it and get a test?
Well, we do have a provider, West River, out in the Rapid City area that is doing drive-up testing. Just a reminder to the public, though, that is testing. It is not results. So what they will do is they will, and I believe these providers, we had a discussion today with them as well, that people may be able to call in, drive up in their vehicle. We'll go through an analysis with them and ask them questions to see if the test is necessary, and do that without exposing anybody else in that facility to potentially becoming contaminated with the virus. So that is something that certainly is available, but I think we need to make sure that we're clear with people. They can't just drive up and immediately get a result. It will still need to be sent to a lab, and they will still need to be called with the results later.
One more question, Governor. Your colleagues in Minnesota and Iowa basically closed the states down. Do you see that happening here, and why not yet in South Dakota?
We are preparing for anything, but at this time we do not have the situation that they have. They have community spread, unexplained infections. That is not the situation that South Dakota is in today. So what we're doing is certainly proactive and appropriate for this time being.
Thank you, Governor.
Stephen?
Looking at the state's readiness in case there is a widespread outbreak, the state influenza pandemic plan has estimates looking at the 1918 or the 1958 levels at 236,000 infections. If there was a 15% hospitalization rate, as there were in some places, that would be about 35,000 hospitalizations. Is the state ready to handle that kind of level, and what actions are being taken to gear up for that?
Well, I believe because of the actions we've already taken, we won't reach that level. But we do have a great analysis of open beds, our capacity, what we can handle, partnerships that we've built with other providers, and resources that I think shows that we are ready to take care of families, and as this virus moves through, that we will be able to tackle it. That's why you've heard us talk so much about flattening the curve. If everybody had gotten sick at one time, if we had taken no proactive measures, I'm not certain that we could have adequately taken care of every single individual. Because we've taken actions, it is working, and therefore I believe that our capacity will be sufficient to make sure that everyone will receive the health care that they deserve.
Maybe this is a question for the Secretary.
Sure.
Has the Department of Health received any requests for personal protective equipment from hospitals, especially smaller hospitals, rural hospitals, community health clinics?
Yep, absolutely. We have an ongoing process for healthcare providers to request that kind of material. We have caches both at the state level and at the local level of supplies, and we maintain that inventory list, get it out to our providers on a regular basis. We have had requests. We've been able to honor those requests. We have priority populations, as you can imagine. PPE requests that are going out are for the purposes of responding to COVID-19. And so, as you can imagine, we're prioritizing this current situation with any supplies that we have.
Yes.
Governor, have you been tested?
No, I haven't. I feel great. So that's good. And we hope everybody will continue to feel great. We'll go here and then I'll come to you, Lisa.
So when the tests are going to be getting, are they going to be coming straight from the test kits, straight from the CDC, or a private business? I know there's been some concern in Wisconsin of the tests from the CDC being faulty.
The tests from the CDC are totally reliable, and so we have no issue with test capacity in terms of getting the test kits that we need from the state public health lab. The bigger pinch point right now is getting the supplies that we need to be able to run those tests, not unlike any other lab, and so we're constantly working on those types of issues.
Lisa?
Just wondering if you're considering expanding the week long for the state employees, the executive order.
You know, we will see where we sit with state employees. We've got a lot of them, they're at home working now, except for the essential employees that need to obviously be in areas where it requires them to be on the job in the positions that they hold. But we'll continue to look at that and see what we can give them for flexibility. A lot of those state employees, and I just want to commend them one more time, they are detailing out to other agencies to help in high demand areas. They're also all weekend and evenings, they are volunteering in the call centers 4 hours at a time, answering people's phone calls and doing that, which I think is just fantastic. So these state employees are really stepping up and filling in a lot of volunteer hours, which makes me even more proud to be from South Dakota.
The federal government earlier today, President Trump and the CMS director specifically talked about opening up regulations and reducing concerns about HIPAA for telehealth, especially FaceTime, Skype, that kind of thing. What are the hospitals doing to prepare for that?
Would you guys like to answer it? We are requesting every waiver we can get from the federal government in regards to CMS and licensure across state borders, what we can do to care for people and streamline those processes. But I know each of the healthcare providers is also doing individual things to streamline and make sure they're getting care out as soon as possible.
Yeah, I would just add that it's very important for telehealth as we screen those patients. So if they call in, we can do a virtual visit and screen them so they don't need to come in, and then they can go back home because we want them to stay at home. 80+% of those patients can be taken care of at home. And then if they're diagnosed with the disease and are at home, then we can monitor them via home care and follow them at home. So very important, those waivers regarding telehealth. And I'll let Dr.
Yeah, we currently are doing e-visits and video visits specific to COVID. So if you need to, you can just go on to my chart and request a visit that way. And then we're looking at adding the ability for, in oncology and transplant and some other specialties, the ability for those vulnerable patients to stay home and do video visits. So the ability to do Skype and Facebook and some of those other methods and easing up licensure really helps us be able to do that much more quickly.
Yep, thanks so much.